Good afternoon. My name is Mike. I'm an RN at the VA hospital. I'm just going to do a quick little brief on, I'm going to compare and contrast two drugs here. I'm going to use the bronchodilator, which is albuterol, and I'm going to do a inhaled steroid, fluticasone. So the first thing I wanted to talk about real quick is the bronchodilator, albuterol. The mode of action of the albuterol is, what it does, it dilates the airways, is the primary mode of action with albuterol. And the buildup of mucus, bronchospasms, and swelling of airways contribute to the shortness of breath in the lungs. So the albuterol kind of alleviates those symptoms, signs and symptoms of the inflammation of the airways. Some of the drug interactions with albuterol, tricyclic antidepressants and monoamine oxidase inhibitors should not be given with albuterol because of the interactions that would take place. Basically what happens with them, because they increase the blood pressure and they increase the heart rate. So it'd be counterproductive to do those, to give the two, because of the side effects. Stimulant medication should not be given, well, they should be given with caution with albuterol, because like I just said about the heart rate and the blood pressure elevates. Also, beta blockers, they reduce the effect of bronchodilators, so you want to use beta blockers with caution also. And loop diuretics also, given with albuterol, can cause low potassium levels. So caution should be given when prescribing the two medications together. The efficacy of albuterol, it's very, very efficient in alleviating narrowing of the airways and providing better oxygenation for and the ability to move air in and out of the lungs. So it's the efficacy is very good with albuterol. It's been used for a long time. We use it a lot on my unit for people with COPD and asthma. Basically what it does, moves air in and out of the lungs by allowing the airways to relax and the spasms to be less, as far as less exacerbations. How safe is it? Generally, albuterol is very safe medication, but like with all medications, there's some side effects, runny nose, headache, dizziness, sore throat, increased heart rate, like I talked about earlier, chest pain, and palpitations could be some of the side effects that be caused with albuterol. The cost of albuterol generally about $60. Give or take, it depends on your copay with your insurance. And expected outcomes, one of the expected outcomes should be the patient oxygenation status is optimal, and the pulmonary functioning and breathing should be optimal also. The patient's respiratory status is symptom-free of exacerbations and well controlled. The patient will be educated on the signs, symptoms, and safety concerns with albuterol. So patient education is very important with albuterol. Now comparing albuterol with an inhaled steroid. So now we'll talk about fluticasone real quick. Fluticasone is an inhaled steroid. The mode of action with fluticasone, what it does is the anti-inflammatory actions of a corticosteroid like fluticasone. It's the thought to believe to inhibit they would thought to involve inhibition of the cytosolic phosphatase A2 inhibitors, and it's which controls the biosynthesis of potent mediators of inflammation, such as prostaglandins and leukotrienes. So the mode of action sounds a little bit difficult, but not really. Just basically, it decreases the inflammation inside the lungs, and it helps the breathing. So helps a lot with the breathing. It brings down the inflammation. You can breathe a lot easier. Some of the drug interactions with fluticasone, certain medications such as ritonavir, Norvir, and ketoconazole will increase fluticasone levels in the body by delaying its metabolism and elimination in the body. So it'll actually increase the levels of the fluticasone if you give those medications with fluticasone. So it's not recommended. The efficacy. Fluticasone is a corticosteroid that stimulates receptors in the body, which helps to produce an anti-inflammatory effect or response. So it's very effective in the lungs, especially sometimes used with the albuterol together. They have a really synergistic effect and really helps with the breathing and the outcomes. The safety, generally fluticasone is a safe medication, but with all medications there are side effects such as cough, vomiting, there could be some nausea, possible nosebleeds, sore throat, and burning of the nasal area, or inside the nasal area, you might have some burning. The cost, generally about $60, almost the same price as albuterol, but once again, most insurance companies, you'll just pay a general copay. Some of the expected outcomes, basically just be able to breathe better and have better oxygenation status. Okay, thank you very much.